Hi, my name is Onyee and I'm a clinical investigator in the Malignant Hematology Department at the Moffitt Cancer Center. The research I will be presenting is related to the outcomes of NPM1 favorable risk AML patients in the setting of secondary type mutations. NPM1 is one of the few mutations that can potentially define favorable risk by ELN 2017 criteria. However, there are increasing evidence that the prognosis of AML with NPM1 may depend on a variety of accompanying mutations. Prior studies have shown 8 mutations, the one that are listed here being highly specific for secondary AML and with poor prognosis. In this study, the objectives are to examine the outcomes in AML patients with NPM1 mutations and to determine the prognostic impact of secondary type mutations in patients with ELN favorable risk by NPM1. We identified a total of 159 AML patients with NPM1. About 20% have a secondary type mutation. Of note, majority of these patients, 80%, have clinically de novo AML. About a third of them have favorable risk by ELN. The overall survival in patients with NPM1 mutated favorable risk AML is significantly shorter in those with secondary type mutations at 11.6 months compared to not reached for those without these mutations. In summary, about 20% of patients with NPM1 harbor one of the mutations highly specific for secondary AML in our series. Majority of them have de novo AML. Prior study have demonstrated secondary type mutations confer poor prognosis in de novo AML, and our study show that this adverse impact extend to those with ELN favorable risk by NPM1. These findings may have treatment implications altering the need and or timing of transplant. Thank you.